Discuss today about again one of the most neglected and important cause of breathlessness, that is pleural effusion. Pleural effusion means accumulation of the fluid in between the space lungs and chest wall. There is a pleural cavity. Actually, there is a thin layer covering the lungs, and outside it the fluid gets accumulated. And more the volume, the lungs gets collapsed. Now the symptoms of pleural effusion again to begin with is pleuritis, where the chest pain happens. On one side the chest pain is pricking and related to the respiratory movements. At that stage usually patients they take painkillers and neglect. And after some time, as the amount of the fluid increases, pain disappears and slowly breathlessness increases. And when it becomes too much, then only they approach pulmonologist. Before that, they will approach all other doctors who are not able to, home remedies and non-pulmonologist perhaps may not be able to diagnose correctly. So by the time pleural effusion becomes massive, that means more than 1.5 liters fluids get accumulated, the heart and other structures gets shifted to the opposite side, lungs gets completely collapsed. That time they approach pulmonologist. The actually treatment is very simple. Simply we just put the needle and take out the fluid as much as possible. Not more than 500 ml, and part of it will send for the cytological examination, biological examination, and see the results. Depending on the cause, most common cause in India is tuberculosis. Other causes are cancer and of course infections, and depending on the cause we treat that patient. So again here the initial approach to the pulmonologist is necessary. Thank you.